Awesome. See, that's that. Christmas songs. Your sanctuary in the all-new sky. Your place for praise and worship. Find your sanctuary in the all-new sky. Good morning to you, my Sky family. Acknowledging Mahon in your company. And as you know, today is Sunday. And it's about that time for the program, Overcoming Health Issues, with the guy himself, Dr. Batson of Batson and Associates Limited. Good morning to you. Good morning, Miss Adana, and how are you? I'm doing well. I got the name correct, right? Yes. Okay, excellent. Always a pleasure to be in the company of the listeners of Sky 99.5, discussing health. Let me say a pleasant good morning to all the listeners, those of you who may be, on your way to church, who on your way. I don't think church finishes yet, depending on which congregation you go to. Those of you who may be cooking, listening to the radio, of course, we're discussing health from a natural and integrated perspective. And, we always encourage you that the program is an interactive program. So keep that in mind. We're going to be discussing a number of health issues today. We're going to touch on prostate, of course. Let me say happy International Men's Day, as far as I understand. So, we're going to be touching on the men a bit. Let me say a pleasant good morning as well to all our social media followers. Keep in mind, we are live on our social media platforms. We are Batson and Associates Limited on Facebook. On Instagram, we are Batson Associates TT. On YouTube, we are Batson and Associates Trinidad. And on TikTok, we are Batson and Associates. So we got you covered there. Make sure, to like us, tag us, share. Especially, based on the content that we always give you guys, always beneficial. Let me say, of course, a pleasant good morning to Miss Pamela Moses, Miss Rachel Johnson, as well as Miss Maureen Pierre Reed, already in the house on our Facebook. And as I said, Instagram, we are Batson and Associates TT. On Instagram. I'm going to give you the telephone numbers for the offices in a bit. Have your favorite products in stock. We have Nerve Restore, that product that helps so many individuals as it relates to depression, anxiety, those type of things. Any problems associated with insomnia, a lot of persons don't really get the quality, the quality sleep that they need, and as a result of that, you find they end up in some problems. So, feel free to give us a call or visit. Those locations, again, we are located on the first floor of Money Talks building. That's Money Talks building in Montrose, Chagonas. And that telephone number, which gives you access to all the other numbers, because you all know is a lot. Of course, it's 222-8261. Again, 222-8261. Adana, of course, I'll let her give you or remind you of the numbers for the studio, and then we will go from there. So just remind them of those studio numbers, and we'll take it from there. Yes, and okay, so before I say the numbers, just want to let you know, apparently they don't want us to good, so I don't have the camera in front of me, so I'm able to. Okay. But that's okay. Nevertheless, we'll have fun. Yes, and those numbers are 624-7729 or 625-2759. You can also send us a WhatsApp 333-9950. Good. So try and do that. We have 2 hours.
and we're going to make the best of the 2 hours that we have. And in addition to that as well, we would actually be doing a live question and answer this evening for you guys, and that is going to be taking place from 7:30. So we go basically 7:30 to about 8:30, 9 for the latest. So that'll be an hour and a half, because a lot of the times, based on the questions that I get over the radio, I try to facilitate as much persons as possible. And then the amount we get on social media, I would at least be able to, give a wider audience a hearing. Okay, so I can keep that in mind. Keep in mind as well, Batson Associates back in Tobago, up and running, as we should be and supposed to be. So yours truly, Dr. Batson, will actually be in Tobago before this month is out. So you could actually call. We have our consultants up there already, some of them. And we're actually there for the past week. So that is something that we have put back in place. Of course, we have Miss Latoya over there handling you. So we almost back to normalcy where there is concern. So that's, of course, very good news. That number for Tobago and locations, we are located in the Triangle Building. That's the Triangle Building in Scarborough. And that telephone number for Tobago would be 226-4553. That's 226-4553, as well as 312-4248. So, of course, because of the response that we always get in Tobago there, I would advise that you call so that you could actually get an appointment. And as I said, I would be there before the month is out to really finish those consultations and reviews that the consultants would have done, right? So to get your blood analysis, to have that diagnostic done, which is the most important thing, that'll be handled by the junior consultants, and myself would just do the review with all the information that I have before me, right? Let's make the thing easy, make it as effective and efficient as possible, because at the end of the day, you came to get results. That pain that you have for so much years, that diabetes, that blood sugar that is not going down, that blood pressure. The last program before, which was 2 programs ago, 2 Sundays prior, I discussed hypertension in a very serious way. And the good thing about that, I believe that it woke up a lot of individuals, because I continue to let individuals know that, high blood pressure is not something to play with. It really isn't your friend. There is no camaraderie. There is no positive contribution to your life when you have hypertension. You're literally a walking time bomb. And I say that with no apologies, because I think a lot of persons don't understand the severity of what they're dealing with until it is, too late. And one of the things that allowed me to really pursue that whole hypertension conversation was, of course, because on a daily basis, even if I do interact with clients, I see those files, and especially when I have to do a lot of review work. So, I mean, I will get the general gist of the file and the general gist of the client in terms of your numbers, whether you have surgeries done, whatever the case may be, right? So, there's a lot of information coming to me. And because we are now in the process of finishing up that integrative, integrative cardiovascular, diabetic, as well as our kidney, center, where we're actually able to help more individuals in a more effective and efficient manner. That's the key to it being more effective, more efficient, because, when you're dealing with a patient or a client, is a lot of work. You have to take a number of things into consideration. If it's one thing they always say at Batson Associates, we're very thorough. And that's why we get the results that we get, because of being very thorough. I'm a huge advocate of blood and blood analysis. Just recently, I was doing a program that was Thursday, because we normally have a lot of programs on a Tuesday. As I said, you could always follow us on our social media so that you could actually get access to those programs. Some shorter than these, or this one that we usually do, but of course packed with information. Thursday, we actually had an excellent discussion about weight loss. So that's one of the other things as well. Batson Associates has finally, again, put that weight loss program that we have been working on for a little while into play. We have actually partnered with a organization that has dealt with weight loss for a number of years, and we actually getting some really good results. These are persons who have serious challenges with weight, serious challenges with visceral fat, If you do not know what visceral fat is, if you have a big stomach, most likely you have a lot of visceral fat. All right. Visceral fat is actually organ fat that is specific in its nature to be very detrimental to the body because of actually trying to kill you while you sleep. And I say that not to be, again, facetious or, to be making any kind of joke where that is concerned. It is literally that. Scientifically, it has been proven rather, that when you have a high visceral fat or high organ fat in the body, you are at a lot of risk. In fact, those persons are the persons who tend to get a lot of stroke. Those persons who have to get a lot of issues associated with brain aneurysms, issues associated with ruptured veins in the what they call deep vein thrombosis. So problems with circulation in the lower extremity of the body. Because remember, you have different aspects of circulation. Some people just believe blood is just circulate through the human body. Just go. No, there's a systematic way in which blood is supposed to distribute itself throughout the body. And that's why blood is the most tested serum. That's why we do so much blood analysis, because blood passes everywhere now. Remember that. Blood touches every organ. It touches the surface of every cell in the human body. Technically, that's what it actually does. It comes into interaction with your liver. It comes into interaction with your heart. It interacts with your brain. It interacts with your eyes. So it means that in that interaction, it takes away information that is vital for diagnostic. And again, that's why blood is the most tested serum in medicine, because of they do PSAs, which is prosthetic specific antigen. They would do TSH, which is a thyroid stimulating hormone. They do a number of things. So blood carry messages, and those messages are in turn interpreted to give you the best diagnostic. And most important, it's not only about the diagnostic, because I often tell persons sometimes when they come to us, your diagnosis is not important to me. And I say that, again, not being rude or facetious in any way, but a lot of times your diagnosis is really not important because the diagnosis is secondary to the primary cause. Very important. We look at because the diagnosis or the symptomology, so the high blood pressure, the diabetes, the angina, the pain in your chest, the pins and needles, the loss of memory, the loss of cognitive function, that diagnosis is not important. If you understand what I'm saying, it is really the effect. Those things are effects. The most important thing is what? The cause and effect. Most important. So that is why, blood is so important in determining a number of things. Women have problems with infertility and those type of things. Blood, because we're looking at what hormone levels in the body. If it is you have to determine if you are ovulating or if you have stopped ovulating, because that is what primarily when women go through, and we're also going to speak on that today, which is postmenopause. A lot of women walking around there very upset, very miserable. When I say miserable, not miserable in being difficult to deal with, but miserable in themselves because they don't feel good. Mm-hmm. They don't feel good. They really, really don't feel good. They have serious problems with depression. I don't know. Everyone at some point in their life would have gone through some form of depression. But you have varying levels of depression. And women with PMS have some of the highest levels of depression, right? And that is because of the hormonal changes in the body as a result of the postmenopausal syndrome. Now, one of the things, and I'm going to touch on that a bit later on as we continue, one of the things a lot of women do not understand with this postmenopausal syndrome, and watch me, I guarantee you all are not guessing and not, watch me, evidence galore, because of the amount of people we interact with on a daily basis. A lot. So ladies, yesterday is International Men's Day, but ladies as well, you all need to mind your business with this PMS thing. It's causing a lot of problems. A lot of you have serious problems with sleep and not being able to sleep, and sleeping tablets is not the answer. It's not the answer. You're going to make yourself more sick. I guarantee you that without a shadow of a doubt. you are going to end up very, 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 a million veries sick. I've seen it not once, not twice, not 100 times, not 200 times, not even 1,000 times. I have seen it. It's bad, only it bad, it real bad, it really, really bad. So ladies, stop being in the corner there and suffering, and your family think. And the thing is, families, and when I say family, your spouses, partners, whatever the case may be, your children, your grandchildren, they don't understand how you feel. They might just think you're just being miserable. Now the thing is, you're not, you may not, as I said, be really miserable, but you're miserable with yourself. So technically, when you're miserable with yourself, you're miserable, right? Because you're miserable to everybody else. You don't like how you feel. You don't want to get up. You have serious bouts of depression. You have serious anxiety attack. That's the next thing. If you're having problems with anxiety attack, and I don't know if anyone ever experienced an anxiety attack before. I have never experienced it, but I have witnessed numerous. It is not a nice thing. Not a nice thing at all. It can send you in the emergency room. Because think about it, you could imagine your heart, babies' hearts rather beat very quickly, and that's because of their developmental stage that they have to go through. So for a baby to have beats in excess of 120, 150 beats per minute, that is okay. But when you have an adult with no exercise, you're not under any strenuous exercise, you're not running, you're not on a treadmill, you're not on a bike, and you having 120, 125, 150, 100. No, 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 no. That is an anxiety or a panic attacks. And ask anyone who gets that, that is not a nice feeling. I tell you, I've experienced people get that in our offices. I've experienced it. Is not a nice thing. It's really not a nice thing. So, ladies, mind your business, sort out yourself. What I want you to keep in mind as it relates to postmenopausal, and this is something that gynecologists apparently don't tell women because a lot of women not aware of this. The only time you do not have a problem with your hormones is when you are no part of this world again. So in other words, when you're dead. That's what I'm trying to say. Because a lot of persons are of the opinion, excuse me, that because you have gone through menopause a number of years, so let me give you an example. Let's say now you are 65 or 70 years old, and let's say you would have gone through menopause at the age of 45 or 50, right? So we're looking at about 25 years, 20 years would have passed, right? So you're 70, 75, 25 years would have passed. Some people have the foolish notion, and yes, I use the word foolish because it's very foolish, and a lot of persons suffering because of that foolish notion. And the foolish notion is that once you have gone through menopause, you have nothing to do with hormones again. Listen to me, that is insanity. Because you can and will, if you don't take care of yourself in most instances, get PMS years after you have ended or went through menopause. And that is a very key point. A lot of women don't understand that. I've known of persons who came to us, excuse me, with hypertension. And the hypertension was not related in any way to hypertension. The hypertension was really secondary hypertension, and the primary issue was hormonal imbalance. I'm not asking you, I'm telling you. Just recently, I had a client who came to me suffering with hypertension for 10 years. And all we did was fix the hormones. Yeah. Because we do alternative hormone replacement therapy. There are alternatives to hormone replacement therapy because you don't want, a lot of times when they give you that estrogen and that, you're in problems. Just up to Thursday when we were having the discussion with that program, one of the things we discussed is cancer as well. Because a lot of persons do not realize that estrogen is a driver for cancer. I'll repeat it again. Estrogen is a significant driver, contributor to cancer. Ovarian cancer, cervical cancer, colorectal cancer, breast cancer, especially breast and cervical, uterine, type of, anything to deal with genitalia and that type of thing, estrogen. Even with men, Estrogen plays a significant role in cancer. Doctors tell men that if you have a prostate problem, they're going to give you medication to reduce your testosterone. But why are you doing that though? Hmm? Your testosterone, I guarantee you, I have never met a prostate patient who had excessive testosterone issues. Why would they give medication to reduce the testosterone? I don't know. Because didn't have any. They already didn't have any. And they just make it worse because you ended up now with impotence, penile shrinkage, loss of a number of things. You basically have no sexual function after that. Because, of course, men need a certain level of testosterone in the body. Very, very few men I've come across with excessive amounts of testosterone. Very few. A lot of the time, those cancers are estrogen driven. Next misconception that people have. So it's not too much testosterone, estrogen. Because you're getting estrogen even in water now, tap water. They have done tests in various parts of the world and actually found that you could get hormones in tap water. And then if it is you consume soy is a phytoestrogen. Phyto standing for plant, estrogen. So it's a plant hormone. So you have to be very careful with that. Because where estrogen is excessive, cancer can become present. Very important. A lot of people don't know that. Right? So that is why this postmenopausal symptom, and we're gonna do some work with that. And that's one when we finish what we're doing in Central right now. That is one of the things that we'll be focusing on. Because so many women, again, suffering. It's really, I talk about people who literally watching a ceiling and contemplating suicide, This thing's serious and all, yeah. It's not a joke, And it's getting worse and worse. I had a case recently. That's one of the worst cases I ever got. Because it was also a thyroid driven. So that person, all the hormones was in a state of affairs. That the endocrine system was completely crashed, basically. Pituitary gland, thyroid, parathyroid, the adrenals, mess, complete and total disarray. Complete and total. There was no order whatsoever in that system. Total disarray. And now, as we started to correct certain things, because the thing is, if you have a thyroid problem, and this particular instance, this person had hyperthyroidism, which is high thyroid function. So under those circumstances, already you're going to have a problem with panic attacks and anxiety. Because if you are hyperthyroid, you usually have panic attacks. So imagine someone who has a hyperthyroid situation and have a hormonal imbalance situation with excess estrogen. That's why the woman nearly ended up in the madhouse. They started her on sleeping medication. Of course, in my opinion, that wasn't the best thing because you was basically altering the brain chemistry. And the thing is, when you use things like serotonin uptake inhibitors and those things, so a lot of them. Now, the thing is, in emergency, you have no choice in the matter, because a lot of times you'll wait until it's really, really serious, and they have no other choice. They're going to sedate you. They have no choice, especially if you start to behave badly, where you start to cuss and become aggressive. And again, sometimes you have persons being diagnosed and they're told that you're bipolar or you have ADHD, attention deficit hyperintensity disorder, or you have this thing, OCD, obsessive compulsive disorder, and all these type of things. But that's not the case. The issue is that endocrine system. Once that is out of balance, remember your endocrine system is responsible for the production of hormones. So when you have a hyperthyroid problem, you in some serious issue. I mean, any problem with your thyroid is serious. Those are things I don't play with. But the thing is, if you understand what the thyroid gland does, you could understand why if you have a hyperthyroidism situation, you have a lot of problems. You're going to have problems putting on weight, or you might find you're losing an excessive amount of weight within a short space of time. Now, there are other issues or diseases that could contribute to that when I'm speaking in specifics as regards to hyperthyroidism. So because of that high thyroid function, do you know you could end up with osteoporosis? What is osteoporosis? Osteoporosis is when your bones lack density. So your bones are comprised of cells, a number of cells, different types. You have osteocytes and a number of other cells in your musculoskeletal system, right? And then remember, red blood cells are produced where? In your bone marrow, right? So it means if you have a thyroid problem, one of the purposes of the thyroid is to signal to the brain that it needs calcium, which is stored in your bones in the form of calcium phosphate, to be released into the bloodstream. So once your thyroid working properly, you would have a proper um, balance and management of the calcium in your bones. But think about this. If your thyroid is hyper, so it's overactive, it means you have what? Excessive calcium being sent into the blood. There's actually a medical term for that, calcium something. I can't remember it off the top of my head. But its definition is excessive calcium in the blood. And that is one of the conditions that you could suffer from if you have a hyperthyroidism situation. You all get it? So that is why I said in the aspect of the conversation that it is not necessarily a symptomology. A symptomology not important. And that is why at Batson Associates is integrative medicine we practice. So some people come to me and tell me they have high blood pressure. You don't have high blood pressure. You have high blood pressure right now because your primary situation is giving you a secondary response, which is hypertension, but you really do have hypertension. If you understand what I'm saying. Yeah. So, food for thought. So again, those telephone numbers and locations, we are located on the first floor of Money Talks building. That's Money Talks building in Montrose, Chaguanas. That telephone number is 222-8261. That's 222-8261. Those of you as regards to your blood analysis, live blood, dry blood, magnetic resonance analysis, that entire executive package, it's going to actually, you could actually have that done. I know we're coming out to the end of the year, so everybody's studying Christmas, right? So you know how we get, how people tend to get. So of course, mind your business still. So even if it is you do that diagnostic, at least you could see about your business, your other stuff, and at the beginning of the year, at least you have some information, you have some perspective from where you are, and most importantly, where you want and need to be. If you understand what I'm saying, because most people tend to use the beginning of the year to make certain changes. I tell persons I'm not really a resolution person, but I believe in making goals. But then your goals have to be, as they teach you, the acronym SMART, right? Specific, measurable, attainable, realistic, and time-oriented, right? So that weight that you wanted to lose, and keep in mind that weight loss program. So you could always call and get yourself listed for that. I know we had some persons before me, and they actually started calling individuals for that weight loss program that we're doing, integrative weight loss. And again, that's for persons who need to lose, some serious weight. If you're looking at 15 plus pounds, then that most likely would be for you, especially if it is you are a diabetic individual, because one of the things that this weight loss program is actually going to do is actually help a lot of diabetics because of the relationship between high glucose and type 2 diabetics specifically, even insulin dependent diabetics, because they tend to put on excessive weight, especially visceral fat and that fat that you don't want because of the injecting of the insulin into their stomach, as belly, as we say colloquially. That causes serious situations associated with weight gain and again hormonal imbalance, because a lot of persons do not know that insulin is what? A hormone, right? So again, hormonal imbalance. So the relationship between even polycystic ovarian syndrome is also, again, because a lot of times they tell women, if it is you have polycystic ovaries, then it technically means that you're pre-diabetic. A lot of people don't know that as well. Or which you're pre-diabetic, you're an easy target for diabetes. Very easy. So, and that applies, as I said, to polycystic ovaries, diabetes, weight gain. So you find that in those situations, that weight loss program is going to work well for persons who fall in those categories. So it's not only about the obesity and losing the weight, but also as it relates to the hormonal imbalance situation, as well as the diabetic or the blood glucose situation, especially if it is you're on insulin. All right, so that's something to pay close attention to. You could always call, get some additional information. Those telephone numbers again and locations. Shogunas is the first floor of Money Talks building in Montrose, Shogunas. That telephone number is 222-8261. That's 222-8261. Tobago, we all set up for you guys your blood analysis, your magnetic resonance analysis scan, and all the other services. We have there some that we have coming soon, before the end of the year, then into early next year, God's willing. That number for Tobago and locations, that is the Triangle Building in Scarborough, Tobago. Very easy to find. That number again for the Tobago office is 226-4553. That's 226-4553, as well as 312-4248. Again, that's 312-4248. We have our eye optics formula in stock. We also have Santulan, the Alkagen water, your nerve restore, circulation regeneration, tea that helps so many persons as it relates to blood pressure, because of actually regulating your circulatory system. Poor circulation is our next whole issue by itself. But we're going to take some calls. We're going to take some questions on Sky 99.5 sides here, and let's see what's going on.
Right. So we have a question here. It's good morning. I was discharged from hospital after low heart rate, low pulse, and low blood pressure. Now my feet is swelling. Could you tell me what's causing it? And do you have stuff that I can take to deal with it?
Just read that one time for me. One more time, please. Sorry.
All right. I was discharged from hospital
Right.
after having low heart rate, low pulse, and low blood pressure. Now their feet is swelling, so they want to know what can be causing it, and if you have stuff that they can deal with it.
Yeah, we do. But the thing is, okay, so if you're discharged from the hospital, there would be a discharge summary, which you possibly may have in your possession. I hope, because that discharge summary would be just that, a summary of everything. So what you went in for, what was the symptomology. If you were given any medication, they would have the medication that you were given. In addition to that, it would have subsequent action that you're supposed to take. So they would most likely refer you to a clinic of some sorts, that type of thing. So make sure and follow up with that. That's very important. As I said, if you have a copy of the discharge summary, that's something that if we get in our possession, it would make, it would give me a lot of context. All right. From a professional perspective, experience perspective, if it is you are told that you have low blood pressure, and you have problems with low pulse, then your cardiovascular system needs some work. That could also, I don't know if it is, did they identify whether it was whether they are male or female? No, they didn't, right? Okay, but the thing is, one of the topics that, okay, so if it's a female, the possibility exists the exact same discussion that I'm having here, PMS. Because PMS also gives that type of symptomology, low pulse, low blood pressure. Usually, if you have low blood pressure, the possibility greatly exists that you have low blood count. Greatly exists. That's something a lot of people didn't even realize. And in all my years of practice, that was one of the first things, like in about the first year, 2 years, I realized, but wait, all these people come in, and every time I get a low pressure, it would usually be a female. And when I check, it always correlates with some sort of hormonal imbalance problem. So, i.e., they're heavy bleeders, so during the menstrual cycle, because of the hormonal imbalance, they have a lot of bleeding, they pass a lot of clots and whatnot. And of course, if you're consistently having a situation like that, especially if your period is very irregular, and as opposed to lasting 5-7 days, you have a heavy bleeding for 15 days, 30 days, of course you're going to have low blood pressure, which is actually a low blood count situation. No, I'm not saying that could only be the reason why you have blood count. There are a number of other reasons. And the thing is, anemia or low blood count is multifaceted in the sense that you have different types of anemia. So a lot of people think, well, okay, I'm anemic, or the doctor tell you, no, there are different facets of being anemic or low blood count because of the multiple components of blood. Remember, when you do a CBC, which is a complete blood count, they look at a number of things. They look at your hematocrit, they look at your MCH, they look at a number, and all those things are specific blood corpuscles. You look at platelets, a number of things. So a lot of persons sometimes, because of that situation with that low pulse, because of that low pressure, it is a serious indication of low blood count most of the time. It doesn't necessarily have to be the only one, but as I said, you would have been given a discharge summary, or as well as some sort of instruction as regards to what next. Most likely they would have referred you to a clinic, most likely cardiology or something like that. So, that's very important to follow up where that is concerned. And of course, if you plan to give us a visit, you can, of course, give us a call and walk with those documents. So at least a consultation would be needed. But pay attention to that, because that is serious. Because, you don't want anybody telling you need to get a pacemaker, or have to put in an emergency pacemaker inside of you because your pulse has gone so low. That's a life-threatening thing. So try your best and work on that as soon as possible. That telephone number,
It's actually a male.
it's a mail. Oh, okay,
Yes.
okay. Well, even more so, because did they give age? Just remind me.
No, they didn't.
They didn't give age. Okay. No, well, if it's a man, that's even more concerning.
Mhm.
Usually, when you have low blood count, is something that you don't really, I mean, statistically, you normally find women suffer from low blood count. No, I'm not saying a man cannot be anemic, nor am I saying that a male cannot have blood situations, hematology issues, so like thalassemia. Some persons are said to be, they tell you have a sickle cell trait, sickle cell, those type of things. All those blood disorders, you usually find. So you would have men that have it, but usually you hardly find, or if a male has a problem with low pressure, then that's concerning. There is also some macronutrient, micronutrient deficiency, there mineral deficiency, malabsorption situation, so your gut not working properly. So I tell persons to eat is human, to digest is divine. So a lot of people eat and sit down and eat on a daily basis, and you ain't getting anything from that food. That's why you're saying in your mind, okay, but I'm eating well. If you are in fact eating well, because eating well is very relative as regards to person's understanding of what is eating well, right? So let's say that you're actually really eating well, and you're not making an assumption and you're eating really badly and not aware that you're really eating badly, because that's happened to a lot of people. I remember having someone who came to me recently, just quick, and we were talking about meat and their diet, and they normally eat a lot of processed meat, so a lot of smoked meats and sausages and those type of things. And for the life of them, they thought that they were doing a good. They didn't realize they were killing themselves because of that amount of nitrogenous waste and all that your body actually has to now deal with, especially your liver and your kidneys. Hence the reason why the person had serious problems with hypertension. So, I'm saying all of that to say, if it is you are in fact really eating well, but you still feel sick, then something is wrong. Seriously wrong. Look at that absorption. There's a product we carry at Batson Associates called Gastro Tea. We also have Digestive Balance, Digestive Restore. There's also a product we carry, which is Stem Cell Digestive. You can check out that. But that I know we have in stock. Good product. Very good product. Because one of the things that you often find is a lot of persons suffer from leaky gut syndrome. Leaky gut is when you have the holes in the intestine. So what we call your microbiome, which is that entire aspect associated with gastrointestinal health, is compromised. Because remember, one of the purposes, or the main purpose of your gastrointestinal system, is to do what? For the digestion, no, oh yeah, for the digestion or the assimilation of food, so that your body can now utilize food and break it down in different aspects, store what needs to be stored where, take out what it needs to take out, and that type of thing. So, and for the elimination of waste. That's the primary two main responsibilities of the gastrointestinal system. So if you're not assimilating your food properly, especially macronutrients, a lot of people don't digest protein enough. A lot of people. If it is, for example, you go to the doctor and you do a blood test and they're telling you that they're seeing protein in your blood or protein in your urine, you're in trouble. Real trouble. Because it means we're starting to see the liver being compromised. We're also starting to see the kidneys. And you all notice I'm speaking a lot about kidneys, because dialysis is not a vacation and dialysis does not feel good. It doesn't. I don't have to go on a dialysis machine to tell you that it don't feel good. Nor that to dialyze is not an easy thing for a human being. People who want dialysis, that's terminal. It's just a matter of time. And again, I say that not to, but you all know me. I'm practical and I bring things into perspective for people. I'll give you an example quick again before we go back to the question. Someone came to me recently with a fatty liver. Said they went to the doctor and the doctor told them that nothing is wrong with a fatty liver. But of course, the person is feeling horrible. They can't sleep, all sorts of things wrong with them, right? So they find they're making sense, so they came to us. And one of the first things that I picked up when I was doing the review for the consultation is I picked up that this individual does not assimilate or break down fat properly. So they have serious problems with undigested lipids. And when we do blood analysis, we see undigested lipids. Undigested lipids. We see it. We see undigested protein because undigested protein in our dry blood analysis leaves specific things. And that again is a marker that they could use for cancer. You all don't realize now that it's like everybody getting cancer. Young people all of a sudden. You think that just stop happening just like that? No. I was telling someone recently, but I'll continue that as we take some questions. Just keep in mind again that telephone number, the St. James office, which is Red Edge Mall, Western Main Road, St. James. That number is 220, that's 220-8113, 220-8113. And Debe, of course, is the corner of Ramsey Mooch Trace and the SS Erin Main Road in Debe. That number for Debe is 223-7515. Let me say a pleasant good morning to Miss Josie Smith. Keep in mind, we're having that question and answer tonight. That's going to be from 7:30 to 9. I'll give you all an hour and a half. So whatever questions you may have, you could actually, but of course, you have to access that from our social media. So those of you who are social media savvy or you have grandchildren, let it put it on for you. Right? We are Batson Associates Limited on Facebook. On Instagram, we are Batson Associates TT. On YouTube, we are Batson Associates Trinidad. And on TikTok, we are Batson and Associates. Those numbers for our international clients as well is, of course, area code 868-366-0180. Okay, so those of you who we deal with a lot of persons overseas. I mean, we live in an international world, right? We live in a global world. We no longer, we're not doing surgery, right? So you don't have to be in front of us. You need help, And I've been the proactive person that I am. I tell people, I waiting to think for me to get a ticket and come. No, that might take too long. You know what thing could happen to you within that space of time?
Right.
Yeah. Okay, next question.
All right, Dr. Batson, good morning.
Good morning, sir. The good sir. I see the co-pilot in the house. How are you?
Yes, I'm here. I'm doing good.
Nice.
I actually have a question.
Yes, sir.
I heard you mention before
Mhm.
about soy.
Right.
And in Trinidad here, especially when persons are
A
vegetarian,
vegetarian, correct.
a lot of soy products.
Yes.
And you mentioned the issue of soy being a plant-based estrogen.
Correct.
Now, for me personally, I use
Mm-hmm.
a milk that's partially soy-based
Mm-hmm.
because normal milk.
Yeah, because you're looking for a healthy in inverted commas.
Exactly.
Yes. Healthy in inverted commas.
I'll spend the day in a small room.
Okay, right. So that does not agree with your stomach. Okay.
And if I like to have tea.
Right.
If I have tea without the milk, I'll be hungry a lot quicker. Like
Okay.
real. What could I do in cases like that?
All right, good. Very good question. Let me just quickly address something before this person leaves. Miss Nina Simone Dascent. She asked up for a number to fax a document. What you can do, just WhatsApp us on 314-9975, of course, area code 868. And once you WhatsApp that, the office will call you and give you the proper instructions as regards to that. All right. So they will let you know. Right. So back to your question. Yeah. So you see, the thing is, a lot of persons didn't realize that soy is, as I said, a phytoestrogen. One of the challenges you have with soy as well is that we have a lot of modified, not we have a lot of what's the word? A lot of modified soy. Yeah. So it's not just regular, it has some sort of, lab situation associated with it. So it's make business now, right? And those things tend to be worse than the regular one, of course. So if the regular one was in a situation, so what I'm essentially saying is that having soy, especially the way, because soy was primarily what? Japanese, a Japanese kind of Asian situation, right? They tend to use that. Now, the thing is, where they got their soy was a complete different thing, because they actually harvested it and that type of thing. So, that is not going to have all those additives and all those other fancy things in it. That's one, right? So having something like that sparingly in between would not have been necessarily bad, especially for that ethnicity of people based on their general lifestyle, if you're following me so far, right? Now, the thing is, when the Western world decided, okay, we saw everybody in soy, but they had genetically modified soy, right? And a lot of the soy on the market is genetically modified, and we know about genetically modified food and that type of thing. You need to be careful in that particular aspect. So, I tell me personally, I leave it out. I don't use it at all because of that uncertainty. If I know, of course, the source exactly where I'm getting what I'm getting, that's a different story. But that's something that I would leave out there. What you can do, maybe the almond that you're doing or you're getting, maybe there's something inside of there, and it could be some sort of preservative that could be affecting you in that way with the bathroom situation. So try and do it for yourself, where you could actually get your almonds, you soak them overnight. What I do, I get almonds, I get chia seeds. So I would soak the chia seed by itself, I would soak the almonds by itself, and I would use sea moss. So I basically make like a sea moss almond chia milk, right? And then what I do is I blend all those and I put a little bit of sea salt in it. But I would do it to last like maybe like 2 days because I don't want it for, I would keep it for extended period. Yeah, and you come out good there. So I would suggest you do a little experiment with that for yourself. I mean, of course, to maybe take up some of your time, but I think you, I,
Is my health
is your health exactly, and I believe you'll get a better response there.
Yeah.
It could possibly be because of a preservative that they have to use. Because once things are boxed and packaged in a particular way, especially liquids, they have no other choice but to use some form of preservative. So the possibility exists may not necessarily be the milk per se, but more the preservative that is present in that. It just may. A lot of those things do agree with persons because they have to put that in suspension for it to last however long it needs to last. All right?
Yeah. Next question
Yes,
is,
sir.
as you were mentioning, undigested fats or lipids
Right.
being found in the blood.
Right.
Because I know a lot of us Trinis and tend to eat and drink together.
Right.
Can that also be a cause that messes up our digestive system?
Definitely. I mean, before.
When it
Sorry. Go ahead.
cold drinks especially.
Okay, good. I'll answer. Just quickly before I answer, let me say a pleasant good morning to Miss Annabella Bay, who is on our Facebook, Miss Tobago. So Miss Annabella, we are in Tobago, as you are very well aware, because I know you went to the office. Or plan to, as I said, I will be there, God's willing, this month here. So you could avail yourself of that. You could call the office. And that telephone number again for Tobago is 226-4553. That's 226-4553, as well as 312-4248. That 312-4248, I believe, is that's our WhatsApp, Shakil. Oh, yeah, that's our WhatsApp number. Okay, guys. So again, 226-4553. That's 226-4553, as well as 312-4248. Keep in mind our question and answer tonight that we'll be having, that's going to be from 7:30 to 9 on our social media platforms. We are Batson Associates Limited on Facebook. On Instagram, we are Batson Associates TT. On YouTube, we are Batson Associates Trinidad. And on talk. We are Batson and Associates. So back to the question. So as regards to the situation with the undigested lipids, and as I said, one of the biggest issues that a lot of persons have is that they do not assimilate protein properly. And a lot of persons do not know that protein is a macronutrient. What does that mean? You need it in large or macro amounts. And the reason for that is for a number of situations, especially as it relates to your muscles. And that's why when a lot of persons tend to start to get older, especially if you're diabetic, you end up with serious wasting away of your muscular atrophy, those type of things. And one of the reasons for that is because of the improper digestion or breakdown of protein. The thing is, your body do assimilate protein the way it used to when you were much younger. So you find that as we start to age, it is very important that we do certain things to help our body, and exercise is one of those things, right? As well. So you have the physical aspect as well as the nutritional aspect, right? So as regards to the drinking and eating simultaneously and drinking cold beverages, that is not good. It seriously affects your digestive system, and it can contribute to the undigested lipid situation. It can contribute to serious malabsorption or improper assimilation of your food. A lot of persons, one of the things too as well, how we deal with persons who have inflammatory bowel conditions. So we're going in a different realm is here now. So we're talking about imbalances or inflammation in the gastrointestinal system. So usually you may have gone and done a colonoscopy. Now, I am not saying that colonoscopies are not good, but you need to be careful. It's not something that you should do on a regular basis. They normally recommend that you do it like every 5 years. If you may be someone who have some sort of history, maybe with colorectal cancer, some sort of serious colon issues, then maybe they might recommend that you do it every 2.5, every 3 years, right? The thing with that, sometimes when the colonoscopy is performed, the medical practitioner would realize or say that you have, because usually when they are ready, or should I, for those of you who are not aware what a colonoscopy is, let me just quickly say what it is. So a colonoscopy is where they actually have to sedate you. So they have to give you anesthetic. And what they do is they insert a camera to get, a device to get out a camera in the anus, and they basically have to guide it in various aspects of the intestines, right? So, a little uncomfortable situation, but yes, they have to put you to sleep to do that. So the thing is, and then usually they'll have to do bowel prep and a number of different things, right? But in any case, when they're ready, they're going to take samples. So they usually will cut off, if you have polyps, they remove the polyps. In some cases, they do biopsies. Of course, you all know where I stand with biopsies. I'm exceptionally cautious as regards to the recommendation of those, because especially in that colon area, you could end up in some problems, right? But God's willing, let's say you do a colonoscopy after God, everything was nice, so you're good. They would be able to identify certain things. So one of the things that is usually identified is something known as irritable bowel syndrome or Crohn's disease. You might hear the term diverticulitis.
Yeah.
Right. Now, diverticulitis, or what is referred to as diverticular, is when the lining of the intestines. So your colon is, you have your ascending, your transverse, your descending, and your sigmoid colon. Now, remember, the colon is actually 23 feet in length, right? But it's all balled up inside of there, right? Now, the thing is, when you have diverticulitis, is when you actually have pockets in the intestinal wall themselves. So you actually have like little openings or little flaps inside of there. Now, what happens with that is that food stuff from that whole digestive process. So we're dealing with the small and large intestine. What you have is things actually get in there and stay. And anywhere food and those type of things stay, what happens? It creates, all right. Yeah, so literally rotting on the inside. And that is what happens to persons like that. Now, we do deal very, very good. That's one of my key areas of expertise with gastrointestinal health, because I did a lot of work when I was doing my master's with that, as it relates to dealing, because that's what the thesis was on. It was actually assisted individuals from an integrated perspective to alleviate symptoms and symptomology associated with inflammatory bowel conditions. And inflammatory bowel conditions go across a wide spectrum. So, as I said, things like Crohn's disease, irritable bowel syndrome, diverticulitis, even colon and colorectal cancer is basically high levels of gastrointestinal inflammatory response. And then I always tell persons, if you have an elevated ESR. What is ESR? ESR stands for erythrocyte sedimentation ratio. And that is the blood test that gives you or sort of points to a number as it relates to inflammation in the body. And always keep in mind, the higher the inflammation is, the greater the likelihood of cancer and sickness in general. Those go hand in hand. That is directly proportionate to each other. So that's something that you need to pay very close attention to. One of the things you could look at Batson and Associates, Alkagen water. I'm a big advocate of that because of what it does to the intestines. Remember, alkaline water is actually a medical device. In medicine, you have devices that cover various classes. So you have various classes of medical devices. 1, 2, whether it's a class 3, class 5, whatever the case may be. I can't remember. I'll get that just now as regards to what class it falls in, but it is a medical device. It's actually used in hospitals in Asia and that type of thing. Where it is used for renal patients, is used for persons with serious digestive complaints and that type of thing, because of its ability to reduce inflammation in the intestines. Santulan is on a higher level, though, but Santulan cannot be used by everyone. So if you have diverticulitis or Crohn's disease, you can't just come and buy Santulan and use it. You're going to end up in serious problems. So that is definitely consultation, blood work that we have to do to dot our I's and cross our T's. But you could get help with that. Because let me tell you something, people who have irritable bowel syndrome, let me paint a picture for you. I'll try to paint the picture as clean as possible. Imagine having to go to the washroom 15 times for the day. And imagine that stool not being solid. Adana say, So you can imagine the discomfort, you can imagine the embarrassment, you can imagine, and that's why I tell persons, I put things in perspective, you know. Most people don't, but I put things in perspective, and I always try to be very practical with the advice that I give persons. That ain't working.
And that's the thing, Dr. Batson. It's
Yes.
not just going to the toilet.
Yeah.
You'll be feeling weak and listless.
I feel very sorry for people who have those problems. And again, the only medical recommendation that you will be made, and again, I always tell persons, again, practical, and you have to, in emergency, you have no choice, you know. Dr. Batson is not one of those people going to come here. I will never tell someone not to take medication. You're mad or looking to get locked up. That is jail business. That's lawyer business. My lawyers will be calling me immediately. Are you mad? Can't tell people that. But what I am saying to you is you have to use the right thing for the right time. And that's what people don't understand. And that's why I tell you all, I'm not in the politics of medicine. I don't have time for that foolishness. Don't. But if it is you in a situation, because the thing is, when you like that, as you rightfully said, Lyndall, you're going to be losing minerals, your body not absorbing anything. So people who have ulcerative colitis, Crohn's disease, irritable bowel syndrome, diverticulitis, it's just a matter of time before they diagnose you with colon cancer, you know. It's just a matter of time. And then what is going to be recommended? They have no other choice because you're in an emergency state, and in an emergency, the physical body requires the most attention. What does that mean? It means you're going to get some prednisolone. That is what you're going to get. The doctor has no choice. And then when they give you prednisolone, which is a serious corticosteroid, they're going to have to give you it in very high numbers. So when the doctor tells you, listen to me, they have to put you on a prednisolone protocol, the doctor is doing what the doctor is trained to do, you know, because he or she has no choice in the matter. Now, I've seen instances where they really overdo it, and then people need to go back to school. I'm telling you. But most of the time, the doctor has no choice in the matter. Any sensible, right-thinking doctor is not going to write a prescription for prednisolone for you. Are you crazy? That is not something people should be using for an extended period of time. If you don't believe me, and this is not Dr. Jason Batson saying this, go and Google now. Steroid-induced diabetes. Go and Google it when you get some time. Steroid-induced diabetes. You don't have to be have a distinction in English to know the meanings of those words. If you don't know, check it. Steroid, which is the medication, induced, caused by the medication, what? Diabetes. So the likelihood that if you have an inflammatory situation and you're using high amounts of prednisolone, the next thing going to happen to you, you're going to end up a diabetic. And I am not making up this. You go, there's research. I have a whole art, I have a whole paper on that. I didn't write the paper, I have a paper that I reviewed on that. So that is, you're not playing. You can't win that battle. What win you think you win and win? Lupus. People with lupus. What is the medication they have to give you? Because they have no choice. The inflammation is so high in the body that you're going to have to take 10 prednisolone a day. But what's going to happen to you after that is a different story.
Yeah.
So that's why I tell people I'm not in the politics of medicine. I don't have time for that. You come and that is your state in life, and you want to come and to try to have an argument with me to tell me the doctor tell you not to drink garlic and not to take tea and don't use ginger and don't use herbs. They don't know anything about that. Hush your mouth. I just always say that. Stay out of that conversation. Stay out of there, because you're going to end up in problems. I have a client who came, same thing. They were put on that, and as a result of that, they are now significantly half blind. They have diabetes, they overweight, and they have 100 other problems associated with, including stage 4 kidney. So,
Wow.
yeah, so that ain't really making no sense. That ain't making no sense to me.
The truth there. And
Yes.
just a bit of my personal experience to Dr. Batson.
Yeah.
I was on prednisolone for 6 weeks.
Right.
Six twice a day, and for 6 weeks.
Right.
I developed symptoms and symptomology of diabetes.
Yeah, that's what I tell you. I'm not making up that. There are papers I've written. There's a doctor, they did a study where that was, boy, that's either John Hopkins or what these people name, boy, Emory in Atlanta there. Some one of those universities. They did an entire study on that. The Italians, well, they're some of the best with clinical studies. They do excellent work. They have studies on that. Blindness, steroid-induced blindness, that interferes, because remember, corticosteroids have serious side effects.
Yeah.
There's a next medication called sulfasalazine. When they give you that, you water more than flour with you. And you really want to sit down and have a conversation with me and tell me that the doctor tell you that you're not supposed to take vitamins and you're not supposed to take herbs. When you stay right there and you'll see how fast you'll die and suffer. Because that's the only thing that could happen from a biochemistry perspective. You have no sense. And then on top of that, it have some people who want that type of medication regime. But keep in mind, understand what it is I'm saying. You know? You have reached a place where you have gone to a specialist who has no choice but to give you what it is they're giving you. But it is you now to mind your business and understand why you're in that situation in the first place. And then on top of that, you're doing that and you're not drinking water. You can imagine you have lupus, you're taking all that medication, you're not drinking water, you're drinking soft drink, you're not taking care of yourself. What do you think going to happen to you? You ain't going to get no choice as to how you die. Where you and God have a contract or something, or let's sign a contract and they say, well, you know, I'll get a stroke, or no, it's all kind of thing you're going to get, all sorts of things. You'll ever see, listen to me, lupus is not, I feel real sorry for those people, I really do. But again, they don't understand that you need different doctors for different times, and I always tell people that. You're pregnant, you're ready to give birth, you're coming away by anyone of us, now associates, we don't deliver, baby. You're not going to the hospital or going to a private clinic, let them do that for you. Different doctors for different time. You want proper nutrition, you want proper diet ethics, you want clinical nutrition, you want reversal of situations. That is where we come in. When you are in emergency and you have no other choice, when you're in the hospital and you lie down there, they're going to give you a blood thinning injection if it is they feel that you had a cardiovascular accident. Why you think when you go in the hospital, the first thing they're doing is drawing blood? Because if they think you had what is known as a myocardial infarction, that's the medical term for a heart attack, you know. So what the doctor's going to do, the first thing they're going to do is take bloods and they're going to look for cardiac enzymes. Why? Once you have cardiac enzymes present in certain amounts, it means and it concludes or it confirms rather that you have had a myocardial infarction. So you have no choice in the matter. You have to lie down. They have to put some needles inside of you, and you're going to have to take the medication. But God's willing, when you come out of there and you're assigned to a clinic, make sure and go to your clinic, get your appointments, follow your appointments, what you need to follow. But the next thing you need to do is find yourself by Batson and Associates, or find yourself by somebody who trained in clinical nutrition the way we are, and integrative medicine, because you are now out of the emergency stage and you want to stay. Well, I would hope, if you have sense, that you want to stay out of it. So you don't go now and just continue. That don't make sense. That don't make sense. And then the next thing they're going to tell you is that you have a kidney problem. Mind your business. Simple advice, you know? Simple advice. Different doctor for different reason. I just tell all of that. So that's why I'm not in the politics. Don't have time for that nonsense. So you sit down and play stupid when doctor tell you, don't take vitamin, don't go and drink no wheatgrass, don't take that. They don't know anything about that. Hush your mouth. Hush, hush. Because them telling you that and they're drinking moringa in the morning. So stay there and play stupid. Next question.
Yes, this is for a man who has his blood pressure is 87/58 and his blood sugar is 90. They're asking, and they have low potassium.
Go again. But just 1 second. Just repeat, start from the beginning, please. I just get distracted by what's happening.
This is a man,
Right,
who has his blood pressure is 87/58.
whoa, right,
His blood sugar is 90
right.
and also low potassium. He's asking what can be used in a case like that.
Well, you're gonna do some blood. Nah, you have to come in the office. You have to do some blood because that's serious. You that pulse, that blood pressure too low. They didn't give her age, right?
No, it didn't.
Yeah, no, but that's serious. And if you put so clearly and based on the blood test with the potassium, that shows serious mineral deficiency. But you have to understand your minerals. So, for example, potassium, calcium, magnesium, sodium. You see, those four fellas, them fellas is get plenty trouble. Those are the minerals that you have to be very careful. Now, you have the other ones where you're looking at your micros. So you're looking at things like your zinc and your selenium. And them fellas are really important in the mix. But the thing is, when you see in situations like that, the possibility exists to you have an intracellular, which is fluid in the cell, and you have an extracellular fluid issue. So as a result of that, you find that you're going to be in some situation there with that imbalance. But that's serious. That's serious. It could also point to some situations associated with renal problems too as well. Watch yourself, because that blood pressure is too low. As I said, I don't know the age. I don't know if you're really senior, but still, that is cause for concern. And there is some sort of malabsorption there. Your body is not assimilating things properly, not assimilating things properly at all. So that definitely, those telephone numbers again, for the Shogunas office, that number is 222-8261. That's 222-8261. Debe is the corner of Ramsey Wood Trace and the SS Erin Main Road in Debe. That telephone number for Debe is 223-7515. That's 223-7515. St. James is Red Edge Mall, Western Main Road, St. James. That number for St. James is 220-8113. 220-8113. And Tobago, of course, is the Triangle Building in the Scarborough. That number again, 226-4553. That's 226-4553, as well as 312-4248. Again, that's 312-4248. Keep in mind, we have those consultants in Tobago, so you can have your blood analysis done, you can have your magnetic resonance analysis done, and of course, yours truly would be in Tobago for this month here. So take advantage of that. The exact dates and whatnot, we'll give you that as time go along. But of course, you can call the office and get the necessary information there. Next question.
All right. This person has lost their taste for the past 7 years. They're asking what can be the cause and what can be used.
They lost taste for the past 7 years.
7 years.
You get COVID before everybody. That, that 7 years, you say, no, that's a lot. The thing is, loss. Okay, so I don't know if you have any oral issues. When I say any oral issues, if you may have done oral work, so if you may have done root canals or any sort of dentistry work, if you did, that could have contributed to it. Apart from that, usually you find taste has a lot to do with digestion. So the possibility exists that that digestive system is not functioning as it should. I mean, not attempting to be facetious in any way here. Check your oral health. I mean, I would imagine, you know, you do like your flossing and, you know, you use a sensible toothpaste, you brush your teeth or your mouth ever so often and that type of thing. So your hygiene on point, right? Outside of that, as I said, it could be some sort of gastrointestinal or indication of malabsorption. When you find your mouth is always bitter, that's one sign of improper digestion. In some cases, diabetics always have a situation with taste, and the reason for that is because of what diabetes really is, because of that high level of inflammation and whatnot in the body. In some instances, it is an indication of toxicity as well. And the body is actually telling you, hey, it's off here, because your tongue is actually the exact physical replica of your intestines. So in other words, if you have a black tongue, and I've seen persons with their tongues literally turn black, it means literally your intestine is black. There is some sort of malabsorption situation. If you have a lot of cuts on your tongue, you find your tongue has a lot of ridges on it, regardless of how much toothpaste you use, how much you brush your teeth, how much mouthwash. No, that is a serious, that is not, that is internal. That's a cry from your gastrointestinal health. Right? Keep it, always know that your tongue is the exact replica of your intestines. Always look at that. So if your tongue always coated, you find your tongue, check yourself. You need to get some water, some santulan, and maybe some inflammation formula. That digestive, that is the stem cell digestive, because that helps really good because it's probiotic, prebiotic, digestive enzyme all in one. And then, of course, there are others that we could recommend depending on what your situation is. But as always, taste and funny taste, mouth springing water, all those type of things usually signals gastrointestinal challenges. Okay.
Next question.
Yes, sir.
All right. Someone says, good morning, Dr. Batson. Is it safe to drink alkagen water every day for the rest of your life? And do you have laminine, wheatgrass, and inflammation formula in stock?
Okay, so the products, yes, we have all those in stock. As regards to drinking the water every day for the rest of your life, I've been doing it for 20, and I don't think I look too bad. So if you can, no problem. I mean, the practical. Okay, so let's be practical. There's an economic consequence to everything. Okay, we understand that, especially after COVID. For some people. So we are be practical in anything. What I normally tell clients, at least if it is you start with us, if you use at least 6 to 9 bottles of the water, you're going to get some significant improvement. We have had persons who use 1 bottle of the water and they call in and it's like, you swear we send God for them, literally, the way they were behaving in terms of the results that they got, improvement in blood flow. One of the first things you observe when you start to drink alkagen water is that you're going to urinate a lot more than you was urinating before. And that's a good thing because it means now that the fluids in the body, the electrolytes and whatnot, actually starting to become balanced. Because a lot of persons have, that's why I was telling the individual who asked some questions down before, I was telling them about intracellular, extracellular fluid. So intracellular fluid is fluid inside of the cell, extracellular fluid is fluid outside of the cell. So that has a lot to do with your electrolytes and that balance. The cells in the body always, remember, the main purpose of the human body is to maintain what? To maintain balance, right? Equilibrium. So whenever you're out of equilibrium or out of balance, you're going to get sick. So when you start to drink the water, what the water does is start to balance those electrolytes. So you realize now it's going to start from a cleansing aspect. So it's going to start to deal with your kidneys. So if you're someone who are kidney patient, or you might be someone who are having challenges with bone creatinine, that type of thing, you may have done blood work and they tell you that you have protein in your urine, that type of thing. One of the things we're also going to be looking at too as well, especially even that weight loss aspect, is where we look at things like your stool, we look at your sweat. Sweat, they tell a lot about you, know. You take some people's sample, sweat you test, they show them that they start balling. Because those various bodily fluids, and then of course you have your stool, your urinalysis, that type of thing. Those things give markers and they identify problems, especially excretory problems and digestive problems. And you know, I think one of the biggest, and that's why I always tell persons, one of the biggest in the issues that people have or drivers of disease is gastrointestinal imbalance. Remember, your brain is considered your second gut, you know, right? Or your gut rather is considered your second brain. I think it's really a first brain of thing, because the thing is, if your gut is not healthy, it affects your brain.
Yeah.
Right? So pathogens. That's why a lot of people have problems with depression and the brain chemistry altered. You always have issues with anxiety and that type of thing, because that microbiome, the intestines, is out of balance. And then remember, all living organisms. So you essentially, that's like candida, for example. We all have candida in our intestines, but the intestines have to be pristine in order for candida to live good and behave and actually maintain some sort of symbiotic relationship where you benefit. But when the gut microbiome is off and the intestines change, it's like if they move you from some part of Trinidad that have plenty security and put you somewhere with hardly have security. So, you know, people feel like it interfere with you and them kind of thing. If you have no other choice but to live there, you and your family, what you will do? You have no other choice. You cannot move. You have to live there. What you will do? As the old people, as my great grandmother say, you do, you die, or you run away, right? So it means you would have to adapt, because I do it. If we can't go, you ain't doing me where you want. So you might have to get out, you might have to become a badger. So the point is, in the intestines, when that microbiome changes, when the environment changes and the environment becomes very hostile, a pathogen that was once good and beneficial to you is no longer good and beneficial, because it had no other choice but to adapt and change. That's the next whole aspect. We could do about 50 programs on that. That's what we call pleomorphism. Because remember, all pathogens, which are either bacteria, virus, fungus, protozoa, or worms, have the ability to adapt themselves based on the environment they find themselves in. So if the environment is an alkaline environment and they're supposed to survive in that, and the environment is now an acidic, dirty, toxic-filled environment, what type of pathogens do you think you're going to get? They ain't gonna be, them fellas are not gonna be too helpful. They have no other choice but to survive in that environment. So they're gonna change, become very aggressive. A number of problems gonna happen. And then what makes it worse now is that if you have leaky gut, where the protein now is being affected and the lining of the intestine is being affected, and you actually have holes in your intestine now, those now aggressive pathogens leaving the intestines, and where them fellas going? Wherever they could find themselves. And then you realize you start to have a lot of joint pain, and the doctor is saying, hey, you know you have arthritis. But what you really have is parasites in your bones. That's what rheumatoid arthritis is, you know. Go and research it. Rheumatoid arthritis is parasites in your bones. How they get there? So that's the reason why you have the swelling, that's the reason why you have the pain, that's the reason why you have your stiffness. So what's going to help that situation? Painkillers, temporarily. But you have to deal with the root cause of the problem. And that is why gut health is so important. Bring anybody with cancer, anybody with any kind of cancer. I tell you that. And let's do a blood analysis on them. This minute, they will run out of that room. The intestines is going to be filthy. It's going to be dirty. It's going to be compromised. because of what you see in the blood. There's something when we do dry blood, we look at something, and let me say a pleasant good morning to the hardworking consultants at Batson and Associates, Mr. Vialva, Ms. Ramdan, Mr. Green, Mr. Stamante. Pleasant good morning to you. You know, you see there's something in the sample, we see things look like bullet holes. It literally looks like if someone stood up with a gun and shoot holes in the center of the blood sample. That, when we see that, that is a clear indication that you have bowel toxicity. There's something known as auto-intoxication. Auto is self. The prefix auto is self. Intoxication, in this case, the suffix is poison. So it means your body is poisoning itself. Why do you think you always have a headache? Why do you think your head always hurting you? People with headaches are some of the sickest people that have. And don't tell me nonsense, but the doctor diagnose you and they put you through a whole pack of foolishness and do a whole set of tests to determine what type of headache you have. So they're telling you, okay, you have a cluster headache or you have migraine headaches. If it is, you only know what I want to tell you. You're inside dirty. That's what I'm telling you. It's nasty. It needs cleaning. You need to start drinking water. That's what you're supposed to be told. Not come and tell me, oh, okay, we did various tests and we now realize you have cluster headaches, and you come to put headache in a category. It's nastiness you have inside of you. That's why your head hurting you. What are you telling me? You have headaches for years? If you always have headaches, I am telling you something is wrong with your intestine. Now, let's take out the eye, because the possibility exists you might need glasses and not aware the possibility exists. If you wear glasses, your glasses might need changing. So there are other things that could contribute to that. But I am telling you, the people with the real bad headaches, there's a client I dealt with some years ago, came in from the US to see us. And she had headaches for 15 years. I'll never forget this testimony. 15 years now. Went all over the place. And she came to Batson Associates. In them days, I used to do blood analysis. And when I put that blood on the screen, I could have finished 5 minutes. The toxicity level in that individual was atrocious. And when I say toxicity, it wasn't toxicity in terms of chemical toxicity, like, because you have different aspects of toxicity and different as it relates to, so we have toxicity associated with things like lead and mercury, and that's not the type of toxicity I was speaking about. I'm speaking about intestinal toxicity to the point that it was so bad that her body was poisoning itself. All the organs in the body were becoming poisoned. And once we corrected that, in 1 week time, that lady's head stopped hurting her and it never hurt her again. And that was 10 years ago. And up to this day, we still in contact and whatnot. Never came back. So there's always a reason why you're sick. And I always tell people, different doctor for different time. Always remember that. Next question, sir.
We have a question here. Someone is saying, good morning. My last reading of blood pressure was 145/99. Is that bad? And do you have anything for it? I'm getting some bad pain behind the neck. They're 60 years old.
Okay, go one more time again for me.
BP is 145/99.
That's too high.
Yeah.
Yes.
Do you have anything for it? The age is 60.
Okay, first question I would like to ask them is how much water they're drinking. So first thing I'll advise you do is take your weight divided by 2 in ounces and start to drink that amount of water. And you can start to do that before you come to Batson Associates. If you choose to get the Alkagen water, which will help you, then so you can do that. You could call. If you can't come for it, you can get delivery. That's one. The next thing, what blood pressure medication you're on. I would assume, well, I don't know. If you are on blood pressure medication, then we might have to look at that as well. Because in some cases, one of the medications that they give you for blood pressure is diuretics. What is a diuretic? So chemically wise, diuretics remove sodium and water follows sodium. So they would recommend things like Lasix, Benadryl, those type of things, right? So you have to be careful with that as well, because the possibility exists now that to bring down the pressure, you're getting dehydrated. But that's a kind of counterproductive move in the sense that it's going to work temporarily, but over a long term, you're going to meet some problems, right? Because as I was explaining, intracellular fluid, extracellular fluid, electrolytes, all those things are important as regards to that hypertension situation, ensuring that blood pressure levels are as they're supposed to. Very important, right? As regards to products we carry at Batson and Associates, we have hypertension tea. We also have the circulation regeneration tea, really, really good tea. That tea has gotten some good feedback. I tried my best to give only something that tastes good. And it works. It really, really tastes good. Tell people saying, Dr. Batson, this thing tastes like it has sugar in it, but it's not sugar. Natural sweetener, stevia, based on the whole composition. Nice tea, really, really nice tea. But it is effective because it helps a lot with blood pressure. Now, the thing is, let me say something quickly with blood pressure. Your systolic number, which is the top number, is very important. However, the diastolic, which is a lower number, is, as my nephew would say, important, right? Because that shows the heart situation. And usually that means people who have diastolic numbers that are very high, then so you go to the doctor and the doctor tell you that your heart is swollen. And that is because the amount of pressure. Remember, your heart is the pump for the circulatory system, right? So if that blood is thicker than normal, it means the pump is going to be under what? Pressure, right? Think of your pump you have home. Sometimes if it is depending on thing, I have seen pumps literally burst because of pressure. So what happens is that the heart starts to get enlarged because the heart is under constant amount of pressure. And that, you could end up with something known as pulmonary. Well, pulmonary hypertension is worse, and pulmonary hypertension is hypertension above your heart, right? As I said, a lot of persons have pulmonary hypertension and they don't know because the doctor doesn't tell you the difference. I had someone, some months ago that came, and I was concerned, and then I sent them for a MR, no, it was a CT. And when we got the results from the CT, it confirmed what I thought it was. And that is, I believe that the individual had numerous strokes. And I told them that. I said, you had a lot of strokes, And they didn't believe me. They said, well, no, if I got a stroke, I would have known. I said, no, you don't know. There is something known as a TIA. Research it. It's called transient ischemic attack. And when we did the CT indicated that they had 10 based on the ischemic lesions in the brain. So what happens whenever you get a stroke, it leaves a mark in your brain. And based on that mark, the CT MRI could, or a CT or MRI scan would be able to pick it up of the brain. And that's how we found out. Because what happened to the individual is that they started, why they came wasn't for the pressure really, they came because of their memory. The memory started to bother them significantly, and because they had some situations with family history of Alzheimer's and whatnot, they were concerned. And then they asked me if it's a family or if it's hereditary. And I said, no, this has nothing to do with hereditary. It has to do with your lifestyle. You're not treating yourself well. You're not taking care of yourself the way that you're supposed to. You're not monitoring your blood pressure. And this is why you got the strokes and you didn't know you had a stroke. The unfortunate thing about that is that if it was left unchecked, they would have gotten a massive stroke. But now, the blood pressure is coming down. The vitals really good. They lost some weight and that type of thing. So strokes are something, keep in mind, especially if you are hypertensive. And that's why I'm so passionate and I try to speak to people like that, because you reach in a situation where you have no choice. You have no choice. And that I find is a hard thing. If Almighty God could give you choice, He said, I put before you a blessing and a malediction. Choose life. And that's God. He give you a choice. You want to reach a stage in your life where you do have a choice? Nah, man. So do better than that. Next question.
Next question, someone says, someone I know always has to use the washroom right after eating. What can they take to prevent or stop this?
Well, the thing is, in all honesty, and this is something that you have to identify. When you have a high fiber intake, you're going to go to the washroom often or more often in the sense of, no, it does not the difference. So this is not diarrhea, stool. The thing is, your stool supposed to be, stool tells a whole amount of information. There's actually a stool chart that we have, which shows you, depending on the color of the stool, the shape of the stool, and to try to make it a little easy on the eyes. I mean, we're going to discuss in filth, which is not it's not something that you'll have at the dinner table conversation. But at the same time, they try to make it practical. But on that chart, and when I say that is documented. There are a lot of things, and that is more in the aspect of alternative integrative specialty as opposed to Western allopathic medicine. But in any case, so your stool is supposed to be the size of a banana, consistency of toothpaste, the color of cardboard. But your color is usually debatable depending on what you eat, right? But your stool is always supposed to be well formed. Now, you will have instances where sometimes you might go and interfere with milk, which you ain't supposed to interfere with, and you find you have a diarrhea situation. You must know based on what you eat. But the thing is, if as soon as you finish eat, you have to run like a crazy person, that you may have to look at. However, if you have a high fiber diet, like myself, I use a lot of fiber. So you use like when you're making shakes, you put like the same almonds I was telling you about, chia seeds, when you're using things like quinoa and those type of things. So usually you find you would have a lot. So you might have about 4 bowel movements for the day. You might have 3 bowel movements, but your stool is always, again, well formed. So that is your key aspect. But if it is you find your go as soon as you eat, you have to be running like a crazy, crazy person. You're going to be in problems. Let me say a pleasant good morning to our social media listeners. Remember, we have that question and answer tonight. That is God's willing from 7:30 to 9. And we will be on our social media platforms. We are Batson and Associates Limited on Facebook. On Instagram, we are Batson and Associates TT. On YouTube, we are Batson and Associates Trinidad, and on TikTok, we are Batson and Associates. Let me say a pleasant good morning to Miss Annie Grant. She says, I am drinking that generation circulation tea for only a week now, and boy, am I getting results. Thank you, Doctor. Miss Cindy Hoyt made a joke. Cindy Hoyt is one of the brat squad that I have. I have 3 women on social media that's given me a lot of problems. Cindy Hoyt is one of them. She's an excellent client out of New York. My dear, I hope all is well with you. And she put Dr. Batson, the poop chat. She put Miss Jacqueline Tyson. She said, Dr. Batson, that regeneration tea works. That's one of our clients. So let's see, we don't bring nothing I don't bring anything to the market that don't work. If it's one thing that they say about us, our product work. As I told somebody, there is expensive, which is a relative term, and there is overpriced. We are expensive in relativity, if you understand what I'm saying. So again, keep in mind that question and answer is going to be tonight, God's willing, on our social media platforms. If you have not joined us, if you do not follow us, that's something that you can do, because you will have access to a lot of information. Miss Crystal Moore says, good day, Dr. Batson. Always a pleasure listening to your program. Thank you so very much. So, questions again.
All right. Someone has 2 questions here. Can the fasting blood test that the hospital orders tell things that is wrong with your blood? And I understand that using a drop of castor oil on your eyelid can break up cataract.
Go again for me one more time.
The fasting blood test that
Right.
the hospital orders, can it tell things that are wrong with your blood?
Oh, yeah, of course. I mean, the thing is, the blood tests are good enough. Their blood, I will never, let me put this into context. Bloods are very, 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 very important. Can't stress how important it is. But what you have to always understand, the results is one thing, You know what makes the difference? The corrective protocol that you are given. Remember, if you take the best, okay, let's say somebody's a very good artist, world-renowned painter. However, the tools that they give him, so you bring this man, he come for an exhibition, you bring world-class painter. But when the man come, you give him a toothbrush and tell him paint with it. What you'll get? What you'll get? He cannot deliver because he doesn't have the correct tools. And that's the problem. A lot of people don't have the correct tools as it relates to information as to how to take care of themselves. And I'm not asking you, and I'm telling you. I'm not asking you that people that don't know how to take care of themselves. Why do you think so much people sick? Now, some of them harden. We have this set that just don't listen and ridiculous, and I don't know, they sign a contract with God and you're ready to dead. You also should have somebody that you need to deal with. You might have reached faster, because I wasn't tolerating you in your nonsense, because I believe we are all adults and big people do what they're supposed to do. Simple. I know maths and physics in that. But it have some people who genuinely do not know how to take care of themselves. They don't know. That situation I explained to you with that person who came to us, who had the stomach issue on the amount of prednisolone. The poor lady didn't know she was going to come in. She did not know how to help herself. She said, Dr. Batson, I heard somebody recommended, some cousin, somebody told her about us. They came to us and they got some good results with a similar issue. And that's how she reached us. And she said, Dr. Batson, use the last resort. I hear that often. And believe me, I take that in all level of humility. Yeah? I don't ever think that, I'm better than anybody where that is concerned, but I am passionate about the work that I do. So I do have time for nonsense. And when we did the work, they got the results that they want. So the blood test is good. It is excellent. But it's the tools. What tools are you given? How could you go to the doctor and the doctor don't ask you how much water you drink? Are you insane? You come to me and sit down in my office and you telling me you're drinking 1 glass of water or drinking no water and you asking me why you sick? Really? Really? Nah, man. And that is why I said in the other program that, and this weekend, that's one of my saying, I'm going to have to put that there, taking that one. Oxygen is to the body what water, no, oxygen, sorry, is to life what water is to the body. That's a profound statement, Oxygen is to life. If you take a bag and put it on your head, how long you live? If somebody start to strangle you, they start to choke you, you could kill somebody by choking them, What's the big term for it? Strangulation. That's yeah, and asphyxiation. All they have a whole set, depending on when they do the autopsy, they'll tell you. Right? So if your breath is taken from you long enough, you will die.
Yeah.
So water is the same to the body. There is no negotiation. If you have an issue with that and you pray, you kneel down and ask God why he make your body 70% water. You have that discussion and argument with God. But I am telling you that if you do not drink water, and worse yet, some of you don't even drink proper water, close to water, you are going to be in problems. You could skin up your face how much you like. You don't like water. Okay, good. I find that is profound stupidity. Plain talk, bad manners. Profound nonsense. Because you're not a child. You're an adult. Man up and drink your water. What stupidness you're telling me you do like water? Big heart back man like you. So what you drinking whole day? You're going to kill yourself. You're going to kill yourself. There is no probably must be about it. Laws and rules are to be followed. There are some rules you could break and get away with it. But the thing is, if you're consistently, okay, red lights. We know why they have traffic lights, right? If you break a traffic light, the more you break the traffic light, the greater the likelihood of what happening. You getting in an accident. But there's a different kind of rule there, right? That is a rule where they have a chance there. Now, water. So the thing is, the more you do not, but let's go with a more serious rule. In fact, not even a rule. Let's go with a law. And this is a law of nature. And gravity is a rule. If you decide, Lyndon, you feel, I don't know, I don't know, your lovely wife, they cook some nice food for you and you're feeling extra strong. And you decide, yeah, what, I feel like going and fly today and I go down run off a building. I feel today I could float. They will scrape you off the ground. Because the law of gravity dictates that all bodies falling towards the earth fall at a constant acceleration known as acceleration due to gravity. You are going to hit the ground and they're going to have to scrape you off a pavement. So I'm saying all of that to say that water is the same. It is a law. It is a rule. And you're going to be very dumb and dotish to be sick, going by the doctor all the time. And you're going, doctor, I don't like water. Well, you take medication and be stupid and don't take care of yourself. That's all I could tell you. And anybody who find I rude, disrespectful, I have no problem with that. It means you like nonsense and you like people to pull wool over your eye. I am not going through that. Do what you're supposed to do. We all adults. And imagine you don't drink water, but you're drinking coffee and 4 and 5 glasses of coffee for the day. And then you go and spend a set of money by a specialist, and then they tell you have cancer. And you say, well, doc, you know, I didn't used to. Well, you're even telling them that because they even learned in that aspect to say, well, you know, because I'm not drinking water, you end up with cancer. They will tell you that that is strippiness. But how is that strippiness? Let me ask you a question before we continue. Could you wash wares without water? So you have a whole sink full of wares, but you have no water, and you have to wash the wares. What are you going to do? Lick it? What are you going to do? So you not drinking water is like washing wares without water. It can't work. It can't work. It can't work. And if you don't understand that, and you feel don't have to be medicine, you don't have to do biology in school to understand that that does not make any sense. Just like if Linda or Batson, I go and eat, I go and work out in the gym, I feeling strong today, I go and jump off a 9-story, and I feel like something going on happen today, I go and float. I go and make news all over the world. No, they will scrape me off of the ground because the law says that all bodies falling towards the earth fall at a constant, that's basic physics we learn in school, fall at a constant acceleration known as acceleration due to gravity. That is a law. So there is a law of hydration. You follow it, you're going to be healthier. You get some alkaline water, even quicker. You don't follow it, Batson is not the place to come. Go by somebody else and stress them out. Next question.
Someone is asking, when would MSM eye drop be available?
We'll get eye drop, God's willing, by the end of this month. So you could always call, let the office know, and we'll go from there.
All right. The person who was asking about the fasting blood test that the hospital orders, they said they're on Enapril for high blood pressure and Simvastatin for high cholesterol,
Right.
which don't take regularly because it's causing weakness in the body. I drink more than 5 glasses of water per day, nothing else.
Good. All right. Well, the thing is, if you, as I said, with blood pressure, especially blood pressure, a lot of blood pressure is secondary. So there has to be a primary cause. So because the thing is, if you say you're drinking water, you say you're drinking more than 5 glasses, I don't know what's your weight, but that's a good way to know if you're drinking correct. Your body weight divided by 2 in ounces. That's simple mathematics. So your 160, half of 160 is 80. 80 divided by in ounces is something like 2 point something liters of water, minimal. So there's a calculation for the intake of water for each individual based on their weight. It's just like when you're doing surgery. The same anesthetic they're using for somebody who's 100 pounds, they cannot use that anesthetic for someone who's 300 pounds. Right? It has to be, and again, there's a rule, and a serious rule too. That's lock up business if they do the job properly. But there's a principle behind that and a protocol. So the same applies where your water is concerned. So once you're doing that and you still have situations, then it means that you need to look at the other things. There has to be something there that is a bit off. So you're going to have to give me more context, or you're going to have to come and see us, because context is important. Information is important.
They said their weight is 130, and they also had quadruple bypass surgery 8 years ago.
Whoa. Well, if you had quadruple bypass, it means that you have a circulatory situation there, right? So it means now that you need to work assiduously on your cardiovascular system. So that's where you use things like circulation, regeneration. It means you're going to have to look at nitric oxide. You're going to have to look at, but that definitely a consultation. Consultation visit. Those telephone numbers again. You can always call the Shogunas office. That's one number where they could guide you to the other offices. That number is 2228261. That's 2228261, and you could always get your necessary information. But that's going to require some numbers and some a blood analysis, magnetic resonance analysis. But definitely you have some situation with poor circulation, because for them to actually do triple bypass, it means that, well, you had blocked arteries. So it means a seriously compromised cardiovascular system. Someone, let me say a pleasant good morning to Miss Kati Samaru, Miss Angela Burrows. Miss Angela Burrows asks, is migraine headaches hereditary? Nope, 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 nope. Remember the saying, genetics load the gun, lifestyle pull the trigger. I always tell people this. I don't hide this from anybody. I come from a family of really bad diabetics. In fact, the reason why I became Dr. Jason Batson is because of my great-grandmother, who was a serious diabetic, and I saw that lady suffer. She died when I was 16 years, and she died in her 80s. And I always knew my grandmother sick. Always. And it was diabetes. She had problems with her eyes. She had a diabetic ulcer that she had for years, even before I was born. And she died when I was 16 years. So that's just to give you some context there again. So it means that the way the body deteriorates. So with that, I knew that it's not a nice thing for people to be sick and suffer and that type of thing, especially as it relates to diabetes and hypertension. Those things are serious. But the point I'm making, even though she had that, and then even my grandfather had it, which was her son, and then the generation after, which would be my mom and them. Well, we do so far nobody has it. Rarely, those who check themselves. But I am not going to get diabetes. I'm not. I could say my diabetes. I could say diabetes is hereditary and just fall into that whole category. But no, I don't do that. There are things that I do not interfere with at all, at all, at all, at all, at all. So as I said, genetic loads the gun and lifestyle pull the trigger. And even Thursday, when we were having a program on Thursday, I was in a discussion because I brought someone on with me. We actually were supposed to have it this morning. That's who we partnering as regards to weight loss. We're going to have on next week, God's willing. And one of the things that she was highlighting is that, because she deals with a lot of diabetics as well, is that a lot of individuals, they don't even know, as it relates to diabetes, they don't know that insulin is the hormone that is causing the problem, especially in the case of type 1 diabetes. And type 2 diabetes, of course, you're looking at different things. So I'm saying all of that to say, as it relates to genetics, don't go on that crutch. That's a crutch. That's an excuse. Don't do yourself that. Because if you make a concerted effort to take care of yourself, you would not have that problem. Again, genetic load the gun, but lifestyle is going to pull the trigger. Next question, sir.
Someone is saying, what can I use to get rid of acid reflux? And can a detox, or what can you recommend?
As it relates to detox, well, of course, Santulan, I always tell people Santulan is a 7-channel detox that cleans and detoxifies kidney, colon, bloodstream, liver, lymphatic system, skin, and your lungs. Just the first aspect, just repeat that, because I kind of multitasking here, so I'm reading, reading on multiple screens here. Go ahead. Just repeat the question again for me.
So they were wondering what they could use to get rid of
Acid
reflux.
Right, that's the part I was trying to get at. Yeah. The thing is, acid reflux is a trouble fella, and again, that's because of imbalance in the gastrointestinal system. So acid reflux, which medically is termed GERD, which is so it's an acronym for gastrointestinal reflux disease. Now, there are a number of things that can cause that. You could have a structural problem where you have something known as a hiatus hernia. So a hiatus hernia, if it is you feel, if you feel the center where your neck is there and you come down to the middle of your chest, that long bone there is called your sternum. If you go down further, you will feel like a little space there, and then you could go across to your ribs. That's your diaphragm. The thing is, people who have a hiatus hernia, where between the sternum, that little piece there, they have an opening. And what the hiatus hernia does, you have something known as your esophagus sphincter. So inside of the esophagus, which is that long pipe after you pass your throat that goes down to the stomach there is a door that is supposed to close off the stomach from the
Um, they would like to know what would be the right figure for them to be at age 60. For a woman in age 60, what is the best blood pressure?
If the thing with blood pressure, I tell persons when you reach, well, I'm trying to be, I am being facetious here. When you reach 100, you expect to be getting no 120 over 80 blood pressure. I mean, in practicality, if you're getting that, well, it's good. It means you're doing something good. But if you give me a 130, a 135, so if your top number, which is your systolic, is about a 135, we can live with that. Your diastolic, which is your lower number, if you hit my 80, give me a little 85, we can live with that. You see, when you start across 90 on the lower number, and you start across a 140 on the top number, then that is cause for concern. Because one of the things I find is they give, some people, they give you too much medication at times. But again, remember, emergency. The problem is a lot of the time, there is no reassessment or proper reassessment, in my opinion, because of how many doctors work at different. So you don't really see the same doctor all the time, and because, I mean, how much doctors we have per citizen, I don't know, I'll have to research that or something like that. So, and that's why I always tell persons that you need to take care of yourself, right? Because there's only so much thing the system could do, right? So in a case like that, if you give them a 135, 85, we could live with that. I wouldn't put somebody on medication for blood pressure 135 over 85, especially if you come and we look at things, we change your diet, because there are things from a dietary and an exercise perspective, you could always manage blood pressure and blood sugar, or get improvements in one aspect, and then of course you dot your other I's and cross your T's with your nutrition and those type of things. All right.
All right. One more question. Someone is asking, can castor oils be used on the eyelid at night to break up cataract?
The thing with castor oil, once it's really castor oil you have, it does do some justice to the eyes as regards to actually being because remember castor oil helps with circulation, right? So it improves circulation. So anything that improves circulation in the eyes is going to help to break up cataract. What you have to be careful is your in terms of your hygiene. So when you're applying things like that, especially to your eye area, know what it is you have. Make sure it's clean, make sure it's hygienic. Don't put anything on your eyes that is not, because then you're going to give yourself an eye infection and you end up with worse problems. So being hygienic is very important. Also ensuring that what you have in terms of the efficacy, the potency, cleanliness. Whenever you're doing anything with your eyes, cleanliness is very, very important. Is your eyes, that surface tissue is very easily prone to infection and those type of things. God forbid, so once you do that, there is no problem. I mean, I'm a huge advocate of castor oil. I tell persons it's one of the best things. It's the deepest penetrating oil, and it does wonders to the lymphatic system. So, go brave. Just make sure cleanliness, right? Hygiene is very important. Sanitary.
Wonderful.
Yes.
All right. I think that's it for questions on our end.
Oh, your end. Okay, good. No problem. So let me say, of course, with Facebook, let me apologize to you guys. We slightly disappeared just now. We had a little technical situation there. To Miss Dawn Ellis, my dear, always a pleasure. I know you asked a question there. I'm going to answer that question for you personally as regards to your reports and whatnot that you sent us. I got them. Miss Melissa Richards, pleasant good morning to you as well. Miss Ria Harikisun, Miss Nicola Hood out of Antigua, pleasant good morning to you. And our always Miss Pamela Moses. So again, we are live on our social media platforms. We are listening to Dr. Jason Batson, the senior medical consultant at Batson and Associates, where we support your health naturally. We are live on our Instagram. Keep in mind that question and answer that we have tonight, and that is going to be taking place from 7:30 to 9. So you can add us, like us, share us. You could actually share that because we will post it. Because a lot of persons that time in the evening, they're taking a little rest, that kind of thing. So you could, come on for a little hour and have that and not any lengthy time, or come on, get your answer, get your question answered, and then go and see about your business. Let me say a pleasant good morning to one of my associates, Mr. Sean Alford, out in Los Angeles. He has actually joined us on our Instagram. Great individual, you know. Next year, God's willing, we have a lot of work to do with ladies. That PMS integrative center that we'll be doing, hormonal imbalance center, women who have problems with polycystic ovaries, fibroids, ovarian cysts, endometriosis, that type of thing. That's something that we'll be doing. As I always tell persons, doctor at the specific time. Remember that, right? So Dr. Batson is not saying, I have nothing against doctors. I always tell people that we are all professionals, and our objective is always to give the client or the patient, in my opinion, the best results. It's never about your ego, and I think people ego just get in the way of certain things. Right? It's not about ego. You come to us to get better, and our job is to get you better. Your job is to be as diligent, and you could ask questions. There's no problem about that. I am big for that type of thing, you know, asking questions, because your perception is your reality, right? And people often are afraid of what they do not understand, you know. So if you have diabetes, understand what diabetes is, understand what diabetes can do to you, and make a concerted effort. If it is you want to live, do what you're supposed to do. And if you want to die, well, then do what you want to do as well, right? Because either way, there's a choice. If you have hypertension, understand what hypertension is. I always advocate getting your machines, getting your monitors, and monitor yourself. People say, a lady tell me, she says, diabetes thing is a money-making thing, you know. I said, well, listen to me. It wouldn't be a money-making thing if you don't have it again, right? She laughed, because she was saying the strips are so expensive and whatnot. Yeah, it's expensive. But you're in a situation where you have to monitor yourself. You have to do it. Too many people take medication by guess. Too many. And that puts you in problems, because the blood sugar going to go high. So you're playing, you know, long time a seesaw. As we used to say, seesaw memory war. You're up, down, up, down, up, down, up, down. Same thing with the pressure. And those constant anomalies in the up, down, excessive highs, excessive low, what do you think that's going to do? It is putting your body or causing your body to go into constant shock. And that causes serious renal issues. Too many persons ending up with kidney problems. And I'm telling you, when you have a stage 5 kidney, Dr. Batson, it must be one of the only people in the world who could give you some help. And I'm not exaggerating there. I'm really, really not exaggerating. You have to put in the work. What I would say to you guys before I leave here is exercise, exercise, exercise. We know you have to be safe, you have to be careful, you can't walk too late and whatever the case may be. You're living in a yard, I would assume you're living in a house. Do some sort of exercise. All you need is all you need is 10 feet enough. You could pace 10 feet over and over. That is exercise. You get some little dumbbells, start to do, because especially if you are somebody with arthritis and those type of things. Remember, our body in motion remains in motion. Our body at rest remains at rest. And as one of the wisest or the brightest people who have ever lived said, the only people who do the same thing over and over, expecting a different result, is mad people. That's the height of insanity. So again, those telephone numbers and locations, keep in mind Tobago. So the thing is, why people might be listening and saying, but how come you talking about Tobago? So Tobago, which we were dotting our I's and crossing our T's and getting all our equipment and everything up there. So we have finished that. So Tobago is now fully open. So yours truly, Dr. Batson, is going to be in Tobago this month. We're going to let you know. And we're also going to be having a digital presence as well, because as I tell you all, we're not performing surgery. So I have to do with my extremely busy schedule, and then of course we have consultants, we have people there to help you. The objective is to give you the results that you came for, right? Keep that in mind. So that number for Tobago again is 226-4553. That's 226-4553. That telephone, because Tobago was waiting for a while, so they are quite happy now. 312-4248. That's 312-4248. Shogunas is head office. That's first floor Money Talks building in Montrose. Shogunas, that number is 222-8261. Again, 222-8261. Debe, corner of Ramsey Chase and the SS Erin Main Road in Debe. That number is 223-7515. As we always say at Batson and Associates, if you think health is expensive, You try sickness. And if you think education is expensive, take a try of ignorance. It doesn't pay to be ignorant in this world. We live in an information age. Yes, you have to sift through your information, but you have common sense, man. And as they say, common sense may be for a book. You're supposed to be able to pick up and, decipher certain things. Keep in mind, again, that question and answer tonight, it is going to be from 7:30 to 9. And that is going to be on our social media. We are Batson and Associates Limited on Facebook. On Instagram, we are Batson and Associates TT. On YouTube, we are Batson and Associates Trinidad. And on TikTok, we are Batson and Associates. It has been indeed a pleasure speaking to you guys. I hope the listeners of Sky 99.5 and all the persons who are here, that you get some benefits. Remember, your rule for drinking water, your body weight divided by 2 in ounces. Oxygen is to life what water is to the body. Mr. Lyndon, sir, and your lovely wife, always a pleasure. Till next week, sir.
That's right. Have a good one.
Yes, sir. Yes, my dear. Take care of yourself. Yes, guys. So, remember that question and answer tonight. I'll see you guys. Take care. God bless. Remember Tobago, that number for Tobago again, and check out our post that we have there. You're very welcome, Miss Tyson. That post that we have there for Tobago, so take full advantage of that. Those telephone numbers for Tobago again, 226-4553. That's 226-4553, as well as 312-4248. God bless, guys. Take care, Miss Sharon Theodore. Thanks so very much for night. And any question, I didn't answer your question. I apologize. What we're going to do, we're going to pull these questions too. The ones that I wasn't able to answer here, because I was inundated on Sky. I'm going to do that for you as well as the ones we had on our Instagram. Okay, guys? God bless. Take care of yourself.